Good afternoon. Today's Friday, January 21st, 2022, and I'm Terry Scoggin, the Chief Executive Officer of Titus Regional Medical Center in Mount Pleasant, Texas. And we're coming today to give our weekly COVID update. And we just got off the phone with Dr. Hellerstadt at the state level. The message across the state is the same that we're seeing here in Mount Pleasant and Titus County, and the same message you're seeing across the entire nation at this point. That the Omicron virus and COVID is spreading widely. We're seeing that on a daily basis, and the last 2 to 3 weeks have been tough. And I want to thank our physicians and our clinical teams at Titus Regional for their work over the last 2 weeks. It's been some of the toughest work that we've ever done. And we hear a lot about, it's just like the cold, and it's just like cold systems and flu systems right now. And you know what? There's a lot of similarities to that. However, it's having a tremendous impact on the community and our health system. And we are having people still in our health system that are ventilated and that are fighting for their life. So even though you hear that it's not the same as it was before, I want to strongly encourage you to heed our warnings and listen to our physicians who are telling us and telling our friends in this community to get vaccinated and to get your booster shot and continue to do anything and everything you can to mitigate it. And we saw the numbers at the state level, and they're consistent to ours. Today we have 17 COVID patients in our hospital. Our 7-day average has been running 21. So we had a couple go out today who actually are still in the hospital. They're just no longer on the COVID list, but they're still in the hospital and they're still fighting. So that 7-day average of 20, we've seen our highest at 25 3 days ago. We're seeing numbers that we saw at our peak about a year ago. And the state is seeing that as well. Across the state today is 13,000 plus in hospitals, the same amount that we had at the highest peak during COVID. So everybody keeps saying, but I'm hearing it's not as contagious or high acuity. It's true. However, your COVID per 100,000 is much lower. But because Omicron is so transferable and it so gets out there to everybody, that the number of people who have COVID across the nation, the state, and Titus County is so large that's why the numbers that we're seeing. So you are seeing that strain on your health systems across that. So we encourage you to get vaccinated. We encourage to help us and to help you over the next few weeks. As you look at our numbers, you can see what the last 2 weeks have brought to us. And we've almost doubled ICU beds in Northeast Texas and almost doubled hospital patients in Northeast Texas over the last 10 days. We look at Tyler and look in the Dallas area, you see about that same thing in the Tyler area, and for ICU beds and hospital beds about doubling over the last 2 weeks. But then you see Dallas, and Dallas is not doubling, but Dallas goes back to they're a few more weeks ahead of us. And we just got off a call with some of the Dallas hospitals, and some of the numbers that are coming at the larger systems are showing 1 to 2 more weeks that we're seeing here. Well, we're about 2 weeks behind. So we're thinking we have between 2 weeks and 3 weeks of this peak. One thing we noticed about Omicron that we saw was we hit our peak surge over 4 months in the last Delta surge, which was our highest peak. We've seen our peak in less than 4 weeks with less than 6 weeks with Omicron. So it's very transferable. You can get it from sitting everywhere. I know you're seeing it. I'd be surprised to see anybody with their families that are not seeing it or have it in their families right now. I know our staffing is tough. We're consistently having to move people around because every day we have people who are testing positive, both physicians and clinical team, as well as we have our nurses across the board, some coming off COVID, their 5 days, some that are now to start their 5 days. So every day's been an adventure. And I applaud our staffing team and our physicians for what they've done to keep our doors open. We've not gone on divert. Through our 5 surges now that we've had, Titus Regional Medical Center has kept our doors open. And we owe that to our community. We're continuing to do it. Now, I would appreciate your patience, and I look for your patience as our emergency department, we're holding 2 patients right now. We've held 5 patients at our longest. And I would encourage you to be patient when you're coming in there. So that's all we can ask right now. We're going to have to do this together. And I appreciate the patience, but those long waits in the ER, we're holding patients, and that's what you're going to see. I get asked every day about tests, and testing is a huge issue right now across the state. Rapid tests are hard to come by. And the supplies across the nation are down. We are having to do in all our clinics, we're having to send out tests. As far as testing centers in Mount Pleasant right now, because of the weather, the only outdoor testing is closed yesterday and today because of the cold weather. So testing is very difficult. We are having our tests in the hospital, and we're able to give those tests, but I can tell you not all our emergency department patients are being tested. If the symptoms are there and it appears to be COVID, they're treating it for COVID and releasing and not testing. They're saving those testing supplies for our highest acuity patients and for any of our surgeries and emergencies that we need to know quickly if it's going to come into life or death for that patient. We are getting some shipments in, and I hope to open back up the rapid test within the hospital and then our antigen test within the clinics, but testing and medicines. At the same thing, monoclonal antibodies. We are starting to do some interesting things with remdesivir, but monoclonal antibodies have gone away. So, that's the one thing we're still challenged with. So the other question we get asked besides testing is how do you know it's Omicron? Well, we know it's Omicron based on symptoms, and we don't have the ability to test, and most health systems our size don't have the system to test that. It takes us 3 to 4 weeks to send your swab away and get it back. So we go based on symptoms, and symptoms that our doctors have studied in the other places. I will tell you, and I'm not trying to scare you, mate. Guys, we've been transparent from the beginning on this. We want you to know what our nurses and our doctors are seeing and feeling on a daily basis, and the stress and the highs and the lows. We are seeing Delta right now. We've seen Delta and Omicron, and they know that because of what it does for the lungs. And the Delta, the virus attacks and holds on to the lungs, and Omicron, it just floats around. So you don't see the lung damage in Omicron that you do in Delta, but our doctors are diagnosing and seeing Delta, and a good mix of that, of what we're seeing. So that is concerning to us, but we know it's both here. Some of the symptoms, do you lose your smell and taste? We still hear that. And the symptoms of Omicron are a lot different. It's more of a cold, it's more of a flu, but you do have consistent of them still losing their taste and still losing their smell. And if you are losing your taste and smell, that's a very strong sign of COVID that you're having to deal with. So again, it's a battle. It's a battle every day. We will get through this like we have. I applaud our team and what they're doing. I just want to thank our physicians and our clinical teams from the bottom of my heart, because I know they're suffering watching these things. We do not have the ability to transfer out, which makes it very difficult. But with that said, our team is doing a phenomenal job of taking care of those urgent and emergent and life or death situations. We've seen several accidents over the last few weeks because of the ice and the weather, and to watch our nursing staff and our physicians and our emergency staff and EMS and law enforcement and fire department all work together to save lives. Even though COVID's going on, life continues, and it's just amazing, and I'm blessed to live in a community to see those types of things. I would encourage you to get your vaccine. We are offering them at the Harts Family Care Center at Harts Bluff, Monday through Friday. Monday through Thursdays, 8 to 5, and on Friday it's 8 to 12. But I would encourage you to get your vaccine, your first, your second, your booster. It's one way that mitigates it. You're still going to get it, and the vaccine's not the right word. I get it, but it will give you some opportunities to mitigate spreading it and mitigate the impact on you. So I would encourage you, I am vaccinated, and I would encourage you to get vaccinated as well. And I talked about some of the things that are going on. I want to give a shout out to Chief McCray. Chief McCray has been a great leader in our community. We truly at the hospital appreciate his leadership from an emergency standpoint, the things he does on a daily basis. Sent me a note this afternoon wanting to thank our health system. His team and his crews were out fighting a fire yesterday, and one of their fellow firemen, one of their brothers, had a heart episode or cardiac episode while fighting the fire. Our EMS team, the ambulance team, was stationed on site. They were ready to go when called in, so they came in, pulled the fireman and worked with him, and were able to do some EKGs and some things in the field. Some of the improvements that we've made in our cardiology service line over the last few years, and they were able to call that in. And the doctors who were on call and the cath lab team was on call was able to get that information from the fire and from the field, and to go ahead and diagnose a STEMI that was happening and a heart attack, and they got the cath lab. So when the ambulance brought the firemen in, they met him at the door with the doctor, went straight to the cath lab, bypassed everything, and in less than 20 minutes, they were able to go and open up his heart and give him what he needs to save his life. And it's amazing to see where we've come over the last 10 years, but in the last 4 to 5 years with our cardiology program and the things we're doing, one of the firemen, one of the people who was risking his life in a fire yesterday, our team was able to help him. So I just want to thank the fire department for letting us know about that and wish the fireman, his family, and the rest of the fire department, knowing that we're praying for them at this time because we know they're brothers and their sisters and we know they care so much for each other, and we're praying for them as they go through that time. But just thank you to the Chief for giving a shout out to our EMS and our cath lab and our emergency department team and our physicians for the work that they're doing. With all this going on, we're still moving on. And I want to congratulate my boss, but also a friend of ours. Rob Holliday is the vice chair of the Titus County Hospital District Board of Managers. He's also very involved in our community. And last night at the Titus County Mount Pleasant Chamber of Commerce, Rob received the Citizen of the Year. It was well-deserved. And I can't think of somebody who more deserved it more than Rob. He has been a pillar and a catalyst in our community, and we appreciate his work and due diligence at the health system and what he does for us on a daily basis, but his involvement with First Baptist Church, other entities in town, and then Titus County Cares, where he leads many programs in the backpack program for the kids and hunger in this community. He is a mentor to me and a mentor to a lot of people here at the health system, and we just want to say thank you to Rob and congratulations to you and your family. It's a huge honor, much as well deserved. So thank you, Rob, and congratulations. I want to finish today and just say continued thanks. John McDermott last week at Big Dog Roofing provided burgers and chips to our team, both at the night shift and the day shift, and also gave them all coffee gift cards. We're going through a lot, and those types of things just mean so much to our staff, and they were so appreciative that the community recognized. And the Chief's words today, really, I sent that out to the team, and they were appreciative of that. But we do appreciate our community, and I hope you all know that we're in this together, and we're working together to fight this horrible disease and mitigate the spread. Thank you for your support of Titus Regional Medical Center. God bless.